121. What is the priority nursing action for a patient with TB developing chest pain during treatment? Answer. Assess the pain and notify the provider. Rationale. Chest pain may indicate pleuritis or other complications. Assessment and notification guide diagnosis per CDC clinical guidelines. 122. What should the nurse do for a patient with TB and a history of HIV? Answer. Monitor for drug interactions and coordinate with an infectious disease specialist. Rationale. HIV complicates TB treatment, increasing drug interaction risks. Coordination ensures effective care, per CDC TB/HIV guidelines. 123. What is the nurse's first action for a patient with TB developing a new fever in a long-term care facility? Answer. Place the patient in airborne isolation and notify the provider. Rationale. A new fever may indicate TB reactivation, posing a transmission risk. Isolation and notification ensure safety, per CDC infection control guidelines. 124. What should the nurse monitor in a patient receiving capreomycin for MDR-TB? Answer. Monitor for ototoxicity and nephrotoxicity. Rationale. Capreomycin risks hearing loss and kidney damage. Monitoring prevents complications, per WHO MDR-TB guidelines. 125. What is the priority nursing action for a patient with TB and a new onset of joint pain? Answer. Notify the provider and assess for gout. Rationale. Joint pain may indicate pyrazinamide-induced hyperuricemia, leading to gout. Notification and assessment guide treatment, per WHO TB treatment guidelines. 126. What should the nurse teach a patient about TB sputum collection at home? Answer. Collect sputum in a well-ventilated area away from others. Rationale. Proper collection reduces transmission risk and ensures sample quality, per CDC Diagnostic guidelines. 127. What is the nurse's first action for a patient with TB developing seizures on cycloserine? Answer. Administer prescribed anti-seizure medication and notify the provider. Rationale. Cycloserine can cause seizures, requiring immediate management and provider evaluation, per WHO MDR-TB guidelines. 128. What should the nurse do for a patient with TB who is a recent refugee? Answer. Screen for TB exposure and coordinate with public health for treatment. Rationale. Refugees from high-prevalence areas are at risk. Screening and coordination prevent spread, per CDC public health guidelines. 129. What is the priority nursing action for a patient with TB and a new onset of abdominal pain on isoniazid? Answer. Assess the pain and notify the provider. Rationale. Abdominal pain may indicate hepatotoxicity, a serious isoniazid side effect. Assessment and notification guide treatment, per WHO TB treatment guidelines. 130. What should the nurse monitor in a patient receiving pretomanid for MDR-TB? Answer. Monitor for hepatotoxicity and peripheral neuropathy. Rationale. Pretomanid risks liver damage and nerve issues. Monitoring prevents complications, per WHO MDR-TB guidelines. 131. What is the nurse's first action for a patient with TB showing a cavitary lesion on a follow-up chest X-ray? Answer. Notify the provider and continue airborne isolation. Rationale. Persistent cavitary lesions indicate ongoing active TB, increasing transmission risk. Isolation and notification ensure safety, per CDC Diagnostic guidelines. 132. What should the nurse teach a patient about TB treatment completion? Answer. Complete the full regimen, even if symptoms improve. Rationale. Early symptom resolution does not indicate cure. Full treatment prevents relapse, per CDC TB treatment guidelines. 133. What is the priority nursing action for a patient with TB and a new onset of lymphadenopathy during treatment? Answer. Notify the provider and prepare for a biopsy. Rationale. Lymphadenopathy may indicate extrapulmonary TB or treatment failure. Notification and biopsy guide diagnosis, per CDC clinical guidelines. 134. What should the nurse do for a patient with TB and a history of substance abuse? Answer. Refer to substance abuse counseling and arrange DOT. Rationale. Substance abuse increases non-adherence risk. Counseling and DOT ensure treatment per CDC public health guidelines. 135. What is the nurse's first action for a patient with TB developing tinnitus on kanamycin? Answer: stop kanamycin and notify the provider immediately. Rationale: tinnitus indicates ototoxicity, risking permanent hearing loss. Stopping the drug and notification prevent harm, per WHO MDR-TB guidelines. 136. What should the nurse monitor in a patient receiving ethionamide for MDR-TB? Answer: monitor for hepatotoxicity and gastrointestinal upset. Rationale: ethionamide risks liver damage and nausea. Monitoring prevents complications, per WHO MDR-TB guidelines. 137. What is the priority nursing action for a patient with TB and a new onset of confusion? Answer: assess neurological status and notify the provider. Rationale: confusion may indicate TB meningitis or drug toxicity. Assessment and notification guide diagnosis, per CDC clinical guidelines. 138. What should the nurse teach a patient about TB airborne precautions in a hospital? Answer: remain in the isolation room unless medically necessary. Rationale: limiting movement reduces transmission risk in healthcare settings, per CDC infection control guidelines. 139. What is the nurse's first action for a patient with TB developing a rash on rifampin? Answer: stop rifampin and notify the provider. Rationale: a rash may indicate hypersensitivity, requiring drug cessation and provider evaluation, per WHO TB treatment guidelines. 140. What should the nurse do for a patient with TB living in a rural area? Answer: coordinate with public health for mobile DOT services. Rationale: rural access to care is limited. Mobile DOT ensures adherence, per CDC public health guidelines. 141. What is the priority nursing action for a patient with TB and a sputum culture resistant to multiple drugs? Answer: notify the provider and initiate XDR-TB treatment. Rationale: resistance to multiple drugs defines XDR-TB, requiring specialized therapy, per CDC XDR-TB guidelines. 142. What should the nurse monitor in a patient receiving clofazimine for MDR-TB? Answer: monitor for skin discoloration and gastrointestinal upset. Rationale: clofazimine causes skin changes and nausea. Monitoring ensures patient comfort, per WHO MDR-TB guidelines. 143. What is the nurse's first action for a patient with TB developing hearing loss on amikacin? Answer: stop amikacin and notify the provider immediately. Rationale: hearing loss indicates ototoxicity, risking permanent damage. Stopping the drug and notification prevent harm, per WHO MDR-TB guidelines. 144. What should the nurse teach a patient about TB follow-up sputum testing? Answer: provide sputum samples as directed until 3 consecutive negative results. Rationale: multiple negative cultures confirm treatment success, per CDC Diagnostic guidelines. 145. What is the priority nursing action for a patient with TB and a new onset of pleural effusion? Answer: notify the provider and prepare for thoracentesis. Rationale: pleural effusion may indicate TB progression. Notification and thoracentesis guide treatment, per CDC clinical guidelines. 146. What should the nurse do for a patient with TB and a history of diabetes? Answer: monitor blood glucose and educate on glycemic control. Rationale: diabetes worsens TB outcomes. Control reduces complications, per CDC TB guidelines. 147. What is the nurse's first action for a patient with TB developing nausea on pyrazinamide? Answer: administer pyrazinamide with food and notify the provider. Rationale: nausea is a common side effect, which food can mitigate. Notification ensures dose adjustments, per WHO TB treatment guidelines. 148. What should the nurse monitor in a patient receiving para-aminosalicylic acid for MDR-TB? Answer: monitor for gastrointestinal upset and hypothyroidism. Rationale: para-aminosalicylic acid risks GI distress and thyroid dysfunction. Monitoring prevents complications, per WHO MDR-TB guidelines. 149. What is the priority nursing action for a patient with TB and a new onset of fatigue? Answer: assess for anemia and notify the provider. Rationale: fatigue may indicate TB progression or drug-induced anemia. Assessment and notification guide treatment per CDC clinical guidelines. 150. What should the nurse teach a patient about TB medication storage at home? Answer: keep medications in a secure, dry place out of direct sunlight. Rationale: proper storage maintains drug stability and prevents accidental ingestion per CDC TB treatment guidelines. 151. What is the nurse's first action for a patient with TB developing peripheral neuropathy on ethionamide? Answer: notify the provider and administer pyridoxine. Rationale: neuropathy is a side effect of ethionamide. Pyridoxine and notification manage symptoms per WHO and DRTB guidelines. 152. What should the nurse do for a patient with TB in a correctional facility? Answer: implement airborne precautions and coordinate with public health for screening. Rationale: correctional facilities increase transmission risk. Precautions and screening prevent outbreaks per CDC public health guidelines. 153. What is the priority nursing action for a patient with TB and a new onset of headache during treatment? Answer: assess neurological status and notify the provider. Rationale: headache may indicate TB meningitis or drug toxicity. Assessment and notification guide diagnosis per CDC clinical guidelines. 154. What should the nurse monitor in a patient receiving isoniazid and rifampin for latent TB? Answer: monitor for hepatotoxicity and drug interactions. Rationale: both drugs risk liver damage and interact with other medications. Monitoring ensures safety per CDC latent TB guidelines. 155. What is the nurse's first action for a patient with TB developing a new cough after 3 months of treatment? Answer: collect a sputum sample and notify the provider. Rationale: a new cough may indicate treatment failure or reinfection. Sampling and notification guide treatment per CDC clinical guidelines. 156. What should the nurse teach a patient about TB contact tracing for coworkers? Answer: inform coworkers to get tested for TB exposure. Rationale: contact tracing identifies and treats exposed individuals, preventing spread per CDC public health guidelines. 157. What is the priority nursing action for a patient with TB and a positive sputum smear after 4 months of treatment? Answer: notify the provider and assess for drug resistance. Rationale: persistent positive smears suggest treatment failure or resistance, requiring evaluation per CDC treatment guidelines. 158. What should the nurse do for a patient with TB and a history of mental health issues? Answer: monitor for psychiatric side effects and refer to mental health services. Rationale: TB drugs like cycloserine can worsen mental health. Monitoring and referral ensure safety per CDC TB guidelines. 159. What is the nurse's first action for a patient with TB developing elevated uric acid levels? Answer: notify the provider and assess for gout symptoms. Rationale: pyrazinamide causes hyperuricemia, risking gout. Notification and assessment guide treatment per WHO TB treatment guidelines. 160. What should the nurse monitor in a patient receiving streptomycin for MDR-TB? Answer: monitor for ototoxicity and vestibular dysfunction. Rationale: streptomycin risks hearing loss and balance issues. Monitoring prevents complications per WHO MDR-TB guidelines.